The government has confirmed this afternoon, just a few minutes ago, that it has offered the junior doctors an average uplift of 22.3%. So that means that the junior doctors who were on strike for the past 20 months, they were holding out for a pay restoration of somewhere in the region of about 35%. They've been talking to the government, the new government, for the last couple of weeks. Remember, Wes Streeting, the incoming health secretary, said he had made it a top priority to get around that table, to talk to the BMA, the union representing the junior doctors, and find a way of resolving this dispute. And it seems that they have done exactly that. So that 22.3%, that will be backdated for the past 20 months. Junior doctors will see an immediate benefit in their pay packets at the end of this month. So that means the BMA will go back to its members and say, do we accept this offer? And it's widely thought that they will accept this offer, which will mean that those 20 months of agonizing strikes, which have crippled the health service, not just in terms of the cost to patients who have had their appointments and operations and procedures delayed after delay after delay, but what it means when the government faces its critics who will say that where are you suddenly going to find all of this extra money to pay for the junior doctors, they will be able to say that we will save billions in pounds. That's what it's cost the NHS. It's cost them billions of pounds to cover the junior doctors while they've been out on strike. Tens of thousands of appointments have been added to that record waiting list. Now, when Labour came in, when they won the election, they said immediately that they were going to create 40,000 extra appointments a week. To do that with the existing staff, they have. So these weren't extra staff they were going to bring in to create these extra appointments. This was just with the existing workforce. To do that, to try and make these extra appointments, 40,000 a week, they would need the junior doctors to stop their industrial action. Every time there's a strike called, tens of thousands of appointments are delayed. And we don't really know the true number of patients who have had delays to their appointments, because we got into a cycle where the hospitals, the trusts we were talking to, were saying we're now so used to operating under these circumstances, we just don't make appointments anymore. So they weren't cancelling appointments, they weren't giving appointments to patients who were still waiting. So the real cost, the number of patients who are waiting for procedures could be much, much higher than the figure that we think, the figure that exists at the moment. So this is a huge development. We will hear more from the BMA this afternoon after the Chancellor makes her statement after 3 o'clock. We'll find out exactly what those figures are. The BMA, the union representing the junior doctors, are not saying anything officially until after the Chancellor makes her announcements to Parliament later this afternoon. But we understand, and this has been confirmed by government, that pay uplift will be 22.3%. So it falls some way short of that 35% that the junior doctors have been holding out for, but it's certainly an increase on the 8% that was imposed on them by the last government over last year. So it'll be in stages, that 8% that was imposed on them, plus another 4%, and then later they'll see the figure brought up to that 22.3%. Tens of thousands of appointments have been added every time these doctors go on strike. It's costing the NHS billions of pounds. So all of that, hopefully, will begin to ease, and that will take some pressure off the NHS. The government will hopefully be able to forge ahead with this big task it has now of bringing down this elective waiting list.